Hello there, and welcome to the surgery. If I'm not mistaken, you're here for a consultation session, your first one? Great. So I'll be your consultant doctor today. Yes, that will be me. I'm in the right place. And how this session will work is it'll be in 2 or 3 steps. First, we will get to the bottom of what concerns you and what it is that you wish to change, let's say. And then I'll give my professional and personal feedback to you on what I believe is the best course of action for you. And then together we'll come to a sound conclusion on what the best course of action for you will be in the long term. Does that sound good to you? Yes, good. Wonderful. So now, over to you. What is it that you're most concerned about? Yes, so obviously a natural look is imperative. Yes. Yes, keep going. I'll just take it in and see what's best. Right. So, essentially, you're worried about the aging process to begin with. Let's take it in steps with this. So you're at the aging process. So you're worried about wrinkles forming. Yes. I mean, so the most common places you'll get wrinkles are here. So you got duck's feet here when you smile. Yes. And then you'll get them here from frowning or being confused. Basically expressions lead to wrinkles. And then you get them here from raising your eyebrows. Yes, these are the most common places for wrinkles to form. You also get vertical lines on your face, so they come down here and here, as, in a sense, our fat moves down our cheeks and these lines become more protruding. But we'll get onto that when we move on to cheeks. Yes, so let's focus on these wrinkles just here. Now you are in a very good position where you have not got to worry about these yet, but I do understand your concern. Someone's very angry. I do understand your concern, and the best way to counter wrinkles is through Botox. You have very soft, clear skin at the moment, and no signs of wrinkles, so I would not risk that yet. I would wait. Yes, some people will tell you to go for early, but I would tell you to wait, because you're not at that stage yet. And it's better to prolong it, because wrinkles are not an issue until they become ridges. And so if you look at someone like Gordon Ramsay, for example, he has strong ridges on his forehead, and that's when it becomes an issue, because you need to fill those ridges. Whereas if you have minor wrinkles, they can be cleared out very easily. Yes. So Botox, I would wait. What I would recommend is a strict skincare routine. Yes, I'm sure you have one. Yes. So that's sun cream every day, even when it's cloudy. If you want to maintain the healthiest skin possible, sun cream every day, because rays still get through the clouds and they can still impact on your skin and make it almost leathery. I'm sure you know what I'm talking about. Yes. So sun cream, and then moisturizing, exfoliation, all of that to make sure that you get the best skin possible. Yes. I mean, makeup's also a good way of countering wrinkles, although obviously it's semi-permanent, so it's down to the user on how they feel about that as well. Yes. So Botox, give it a year, maybe 6 months. What do you prefer? I mean, yes, you are concerned about it obviously, but you haven't got anything to be concerned about at the moment. Yeah, I do understand, but you want to do 6 months. We can do 6 months. Come back in 6 months and we will reevaluate the wrinkle situation. Not to be rude. It's fine, everyone gets wrinkles. I mean, I've got wrinkles. It's completely natural. Re-evaluation. So let's move on to different areas. So you were saying about cheeks and lips, yeah, and also chin, not chin but neck. Your neck seems fine. I would start with neck because that seems like a good place to call. Obviously, the problem is some people pull the skin, and you don't want to pull the skin like this. You want to go muscle deep with the neck, because otherwise you get a very fake look. So you haven't got this issue at the moment. As you age, the muscles here become more relaxed, and so they hang down further. I would wait for that again. You don't need that to be done. That can be done in 2 years. That doesn't even need to be done. Maybe even more than that. You could go for a very long time without. Don't worry about that. Yes, that's one of your last issues to worry about, I would say. Yes. Yes. So is it okay to move on from that? Yep. Good. So the more important ones are the cheek and lip fillers that you said about. Right. I mean that's an easiest fix. I mean, looking at your face artistically, you wouldn't need that done. You have a very symmetrical face and no feature draws away from it. So like your lips aren't too thin, your cheeks aren't too like low. So I wouldn't say you need it. So I'd have to seriously think about it. But should you want some filler in those areas, then we could consider it. Yes. So let me throw on some gloves so I can just show you what we may do should you wish to have this done. The lips are easy. You'll need to come back in for top-ups when you get these done. But what you have done takes. I mean, lips could be done in 5 minutes theoretically. It won't be 5 minutes, but theoretically it can be done in 5 minutes. Yes, and cheeks it's a little bit of a harder work because it depends what we do. Because with some people, you have to, like I was saying earlier, you get vertical lines as this muscle and fatty tissue area moves down. So you get these lines here become more and more protruded. And so you have to make more serious incisions. So you would make incisions on natural skin folds where there's a lack of tension. So here and here, by making folds along here and here, we get to avoid any scarring and it naturally blends back into the skin. So if I made an incision here, like along there, yes, obviously there would be a clear scar, yes, because it's against the tension, yes. But by making on the natural points of low tension, we can avoid scarring and then move muscle and fat up higher into your cheekbones, just about here. Yes, just there. So we can do that. That's the natural way of doing it, or we can do it with fillers. And now, with fillers, you can have the best of both worlds. You can have the tissue moved up, as well as like a natural gel injected in to give you fuller cheeks and what some consider to be a more youthful look. Yes. Yes. I mean, we won't rush into anything, obviously. That is far from the aim here, but yeah, that's something that I would say is probably your best option. I mean, you haven't got a lot of movement down from here, so there's not much to take back up, if that makes sense. So fillers may be something that you require. Swelling isn't normally that bad. You can, if you get it done in the morning, you could be going out at night and no one would know. Because if you have incisions here and here of that inject, then no one will be able to see, and typically swelling's not that bad. Of course, some people can get reaction to it, but obviously we will test you for that as we progress. Then, like I said, there's no rush, so. Yes. So that sounds good. Yeah, you like the sound of that one. Right. Now lips. Your lips seem perfectly fine. Would you want top or bottom? Bit of both. I'd recommend top first, and we'll see how we go. It's very bite-sized chunks, like very piecemeal stages that we will take to achieve this. We'll make injections here and here. This is in your top lip, here and here. And then just go from both sides and do it nice and equally the whole way along. Yes, just make the injections there. And then you would have to come in for multiple appointments so that we don't escalate too rapidly and get you past the point you want to be at. Yes. Bottoms, I would say that you don't need them done. If you want them done, we can obviously get them done, but yeah, I do understand. But like I said, it's piecemeal, so the first one we can do your lips, your upper lip, and then the second time we visit you can decide whether you want the lower lip done as well. Yes. So, that covers most bases for this. Now, do you have any serious questions for me? Yes, you could get cheeks and lips done in the same period. We would give you like a 2-hour slot for that to be done because we like to give larger slots and take less time than give small slots and be rushing throughout the day. So it would probably take an hour and 45 to do your earliest surgery. Yes. Yeah, and then wrinkles, wrinkles I wouldn't worry about. On you, we probably wouldn't make incisions initially. We would inject first, just into your cheek, just to see how it goes, very lightly. Like I said, we do it very step by step to ensure that you get the ultimate experience that you're after. Yes. Yes, that looks good. Yeah, any other questions? What was the routine? Like I was saying, you need moisturizer, vitamin creams as well, if you have vitamin creams. Yeah, I mean, just head down to any pharmaceutical company. Yeah, like Boots, anything, really. And just, if you have a strict regime, then you'll have healthier skin for longer. And also I should mention that once any injections or any surgery's been done, sun cream is a key component of surgery. You will need to wear it religiously, very, very religiously after it's been done. Without fail, pretty much. Yes, you need to not avoid sunlight, but it's best to avoid sunlight for the first week. I'm not saying walk around with an umbrella, I'm not saying don't go out in the sunlight, I'm just saying strong application of sun cream for the first 5 days at least. Yes. Yeah. Just to be safe than sorry, really. Yeah. Yeah, I mean, it's the same with lots of surgeries. You don't want to be, especially if you have scars or anything like that, you don't want to be going out in the sun and then, like, getting too exposed. Yes. Well, I hope that has helped your mind. Now, let's talk about your second consultation meeting. Yes. So I said with Botox it'll be 6 months. Yes, 6 months. I would say it's down to you really for the injections and fillers. Consultation, not the surgery, no. You think? Oh, ASAP. Well, I'll say probably give it 3 weeks. 3 weeks time, come back in. Yeah, 3 weeks sounds good to you. Great. Well, I'll look forward to seeing you then, and we'll go into more details, and then from that point we can look at organising an actual date for surgery. Great. Well, thank you very much for stopping by. no, the pleasure's been all mine. Very, very nice. Thank you. Yeah, goodbye.